Welcome, welcome, welcome. Thank you for joining us for our Compcare series. This is part 2. We are focusing on improving practice profitability. If you haven't already checked out Compcare 1, you can hop over to Mint Conception's YouTube channel. It's available there. You can watch it anytime and then pop back over here, pick up where you left off. So today we are looking at finding value in your existing schedule. I know this was a big question for a lot of you that signed up for the course. So we are diving into that today. A little bit of background. So we're Mint Conceptions. We are leadership coaches, administrative support. So essentially, if you have an issue from startup to retirement with your practice, we likely have a solution. For us, we are dentistry focused. So that's what kind of sets us apart for you guys, especially. We have a lot of experience with all of your issues. So we have a unique vantage point of understanding what's going on in your practice and the ways to combat those issues. So a little bit of background on me. I'm Ashley Boaz. I have been a hygienist for the last 16 years and been in dentistry for over 25. So I hate to give away my age, but there we are. But with age comes a little bit of knowledge and wisdom. So I have learned over the years the things I appreciate and wanted to pass on. When I was younger, my mother got braces. I thought it was the coolest thing ever. And so I wanted to be in dentistry from that moment forward. But it was a passion for me. So that did not die. It just changed over the years. So now here I am doing the leadership side of things. I have a lot of experience with HR and the clinical care side. So I like to pass on that knowledge. There's been so much given to me over the years from this industry that Compcare series was one of those ways of giving back. So here we are. All right, so this course is designed to enhance your practice profitability by understanding the missed opportunities within the scope of routine comprehensive care. And so for a few objectives of what we're trying to cover today, we're going to do those missed opportunities, maximizing your patient engagement, implementing same-day treatment strategies if you're not already doing those, enhance your hygiene services. So this is a big one. Optimizing your scheduling processes, improving financial discussions, and applying appropriate communication techniques. So this is for pretty much anybody in the dental field, and it can be used outside of that, but it's primarily for you guys. All right, so 101, maximizing your existing schedule. You already have a schedule to work with, so no reason not to use it. So for us, we're going to enhance that patient care and practice profitability in one. And what we're not discussing in doing that is ignoring patient health for profit. So if you're here to find out about prescribing unnecessary or poor outcome treatment options, that's not what we're doing. We're not discussing working systems to beat insurance frequencies or parameters, which I don't think anybody's here for those things, but covering that we're not discussing those pieces. And your recommended care must be best practice ethical care, not insurance dictated care. We are not trying to focus on what the payout will be. So I think that one is one that we actually are guilty of a lot of the time, is we focus on what the insurance will do instead of what's best for the patient. So we're going to work on correcting that. All right, so the benefits of finding value: it increases better patient outcomes for a more profitable, efficient operation. So with those increased revenues, you don't have any additional marketing expense wrapped up in that. So that's a great win for your practice. The enhanced patient care that builds the loyalty, you have higher patient satisfaction and customized care. And with improved treatment acceptance, they have that immediate access to care that creates urgency and reduces the risk of deferring the care down the road. And with optimized practice efficiency, you learn to identify those opportunities early, so you streamline your operation and maximize patient-provider time while they're in the op. So let's dive into those opportunities. So we're going to unlock the value in your current schedule. You already have one to work with, so no reason not to start there. Every appointment represents an opportunity to enhance patient care and increase practice profitability. You've got to focus on creating value in every appointment. I don't like to look at just production per hour. Yes, it's a marker, but I like to see production per visit. How efficient were you during a visit? Because sometimes our schedules ebb and flow, so that production per hour can ebb and flow. But overall, if you are maximizing how productive you are in a visit, it's going to improve the overall production per hour. And overall, when things are really good, it'll stay good. It'll be even better for your practice. All right, so we're going to identify those missed opportunities and address often overlooked chances for same-day treatment in both restorative dentistry and hygiene. You're going to enhance those hygiene services. If you're not already doing this, is something we'll talk through briefly on leveraging added service items such as cosmetic enhancements, preventive care, to improve your patient outcome overall and satisfaction with their health, their smile, and their visit to your practice. We're going to work on optimizing your appointment scheduling. So strategies to ensure all necessary procedures are completed during scheduled appointments and how to capitalize on these same day opportunities. And then understanding the power of same day treatment, understanding the impact that this can have on your practice. So for the missed opportunities, there's lots in restorative dentistry and hygiene. One of the key areas is you want to plan ahead. Review your schedule the day prior to add opportunities and missed procedures and identify possible same-day patients. Morning huddles are great, but they're only great if we did the prep work. So we have to kind of look through and see what's going on and talk during those meetings to see where can we help each other build out our schedule a little more. For restorative dentistry, you want to focus on offering those same-day treatment for issues identified during routine exams. A simple filling, let's not wait. Let's not get them back in. It shouldn't take you that long. They're in pain. Let's try and take care of it today, because nobody's happy when they have to go home in pain. Hygiene, offering additional services like fluoride, irrigation, products that add value, night guards, sealants, PRRs are preventive resin restorations. If you're not using those, I would recommend you guys discuss those. It's an added service value. And then, fluoride therapies, cosmetic services for whitening. There's so many on hygiene that you can pull in, that there's really no reason to not maximize that hygiene schedule. You just have to be proactive and really plan what you're going to do. All right, so my pro tip that it gets lost because we're usually small practices, right? You're usually anywhere from 5 to 10 people in one office. And short of working for a DSO, you don't often have these standard operating procedures that have been formed. So this is something that your business has to create as a small business. And these are important. Doesn't matter your size. Why? Because it helps everyone understand why we do what we do, why it's important to do what we do, and the mindset behind that. Why did the doctor make this decision in the first place? So the standard of care, you want to set that for your office. It creates consistency for your entire team, for your patients, and then across providers. So if you have multiple associates in one practice, you want to make sure that it doesn't matter if that patient gets seen by one doctor or the other, that they're going to pretty well align on what they expect to see for a filling, for a crown, and the general treatment recommendations for your office. What's the ideal standard of care? Now, that's not to say that we don't have deviations here and there, but those are special cases, and there should just be a general standard of care of how you want patients to be treated, the experience you want them to have, and that goes all the way from treatment to the language that we use with patients. So for hygiene services, we want to focus on offering some exclusivity and inspires that greater desire if they feel like it's exclusive. So in doing that, you got to put on your researcher cap and start looking for unique service offerings. And as hygienists, we can do this very well because we know, A, what we like doing, but B, what our patients complain about, what they wish they could do differently. So you are in a unique seat where you get a lot of feedback. And so you can help find hygiene services that will supplement what you're already doing, that the patients will like and be more willing to accept because you like it and you are willing to recommend it. All right, so for increasing value in hygiene appointments, look for exclusive products. I've seen lots of different high-level products that are out there and available to patients. It looks clean, looks fresh, modern. There's even, new therapies, red light, ozone. There's new things every day coming out. So look for those and add them for that added service value. Get the research together, have a conversation with your doctor about what you can implement to bring value to your appointments. You want to look for things that will improve their quality of life and improve their treatment outcomes. Ultimately, that's the goal, not just something else to add cost, right? So what products can you incorporate to benefit your patients within the next month? That's what I want your question of the day to be for my hygienist, is look through and see what's available out there to you that you could very easily incorporate, but then also look for things that you might want to work on incorporating over the next 6 months, year, things that you'll tier out after you can gauge interest. So the other thing we can offer for hygiene is cosmetic services. We are uniquely situated with all of those complaints that we get. One of them is they will be honest with you about how they feel about their smile, and any sensitive areas, you're going to find them right off the bat. So you can offer teeth whitening, desensitizing treatments, and other cosmetic services are easy conversations during hygiene visits. And then the doctor coming in is just cherry on the top. To make it a practice to discuss cosmetic concerns to promote doctor procedures such as clear aligners, smile makeovers, whatever the patient may have an interest in, you guys can chat through it while they're a captive audience in your chair. For preventive care, you're going to emphasize service items such as night guards, sealants, cancer screenings, irrigation. There are lots of missed opportunities on hygiene just because we didn't have the conversation. And if you don't have the conversation, then you're reducing the value for both you, your practice, and the patients. And nobody wants to be a tooth scraper, spit sucker. So let's add value. Let's find opportunities to actually practice care. And then standard of care initiatives should be in place. So you should have, on an annual basis, we do X. Part of those routine exams, for me personally, in the offices I've worked in, we implement the OCS, the cancer screenings, once a year. Part of your annual exams, we're doing it. I have a family history, so this is very important to me. I understand what kind of impact it can have. So I also understand the value that finding it early can create. So there are lots of things you can implement, but set up a standard of care so everybody's operating on the same wavelength. You all are doing the same thing. Your patients get the same care. It doesn't matter which hygienist they see, but make sure that everybody's on the same page with that. So you're going to leverage those scheduled appointments to really optimize what they're here for and build out that Compcare. That's what this whole thing is about, right? Treating them comprehensively instead of just single problem focused. You're going to look at their appointment and add necessary due procedures. I know this sounds like common sense, but you would be surprised how much money walks out your door because x-rays weren't done when they were due. Canos weren't done when they were due. Cancer screenings weren't even discussed. These are all things that should be done at regular intervals. Fluoride is another thing that can be added to the schedule to help build out those appointments. So you want to leverage what you've already got and add the basic common sense procedures that need to be done on a regular basis. If you're not perio-charting once a year, at least you need to be doing this so you can monitor for any changes, and then you can change the types of cleanings that they might need if there is a change in their health, but you're being proactive in monitoring your schedule and monitoring their health. So for same-day opportunities, you want to encourage providers to examine both the existing schedule that's already there and their patients and offer additional treatments and cleanings on the same day if the patient is already scheduled. So they're already in the office, save a trip. Lots of times you've got a patient on the doctor's side who hasn't had their hygiene. They finally called to schedule this filling that they didn't do 6 months ago, but they were actually due for their cleaning, but they scheduled because someone had called about a cleaning. A lot of times, lines get crossed and they don't know what they were calling for exactly. They just know someone called them. They know they had a filling. But you can find those opportunities. Okay, they're going to be here already. Maybe we can pop them over to the hygiene schedule for a 30-minute slot afterwards just to get the cleaning, because they'll already had the exam in the doctor's side. If we talk about it in advance, you can really work these things out well. Same thing for the hygiene side. You can look through the hygiene schedule and find boo-koodles of old treatment that's hanging out there that likely needs to be revisited, may be larger surface, more involved at this point, but at least it's something you can look at and discuss and know, okay, do we have any current promos going on that maybe this patient's interested in Invisalign and there's a current promo for Invisalign right now. That way you can maximize what you've got going on in the office and pushing them over to the same day schedule on the doctor's side if he has an opening. You guys talk about trying to work through these patient issues in advance. That morning huddle can be much more effective. All right, so we're left at that intersection, as always, of wants versus needs. So you've got to build value. You've got to understand the difference and educate accordingly. So people buy with emotion and justify with logic. We already covered this once before, but it makes your job all the much harder. So the power of same-day treatment is they're already in your chair. You have a statistical advantage because we want it now. It increases the likelihood of treatment acceptance if a patient schedules and pays the same day. They're there. They gave you money. They're committed. They're going to go ahead and do it. It's up to you to find a slot for them. Financial discussions. So a lot of us in our practices, we have these treatment rooms that we've set up for patients to go and have these confidential conversations about their really large treatment plans. And that was an old way of doing business. Not that they're not effective. They are. If you have someone that is having a big case and they want to talk about this, it's nice to have that place to sit down and have that one-on-one where you're not still sort of in their mouth, right? But if it's a simple thing, we're doing a couple of fillings, let's try and get it moved over today. Let's get them scheduled. Trying to do it right now if we can, then complete that financial discussion chairside. Go ahead and talk to them. Sit them up, take the bib off so they feel like a human being, but keep them engaged and talk to them in the chair so that they don't do the mental checkout, because that's what happens when they get up from their seat and they start to leave the office. If they see an outside window, it's over. They're ready to go. But while they're still in the chair and they're focused on treatment, they're still talking to you about treatment. They're not focused on, I have to leave, I've got to get my kid, oh, I've got to go, I've got to get back to work. No, they're still in your chair. They're still focused on you. So that's the place you want to try and have those conversations. So the power of same-day treatment. We are a now society. You greatly improve your odds of treatment acceptance with same-day treatment. Patients who schedule and pay today are less likely to delay. All right, so patient engagement communication. We want to have proactive conversations. You want to train your staff to have proactive convos about treatment options and additional services while the patient is in the office. So they shouldn't just be popping in, get the x-rays, doc will be right with you, and pop back out. You want them to be talking to that patient about what brought them in, what are they concerned about, have they had any thoughts about how they'd like to change their smile, is there anything they're unhappy with? And then any promos you guys are having, if you are doing an ortho promo or a whitening promo, having those conversations with them as well so that they know what you're doing right now. So that will be a little more of fuel in the tank for when they come to have that conversation with the provider. Communication techniques are really important. What we say matters. So you want to document and train all your team members on effective communication strategies to ensure patients understand the value and necessity of proposed treatments. So what does that mean? Again, we're going back to those standard operating procedures, the SOPs. A lot of small practices don't have them. It's really important for your whole team to understand how you want the business to run. So if you don't have anything documented, it's harder to train the new hires when they come on. There's no continuation of that knowledge onto the next person. You may have worked it out perfectly with your front desk team that's been there for 20 years or your hygienist that's been there for 30. Great. But when they go to retire, when they go to the next job, did you document it down so that the next person knows the expectations and what you'd like to see happen? It's really important to write it all down. One of the things I like is for when you're putting your language document together on how you want patient conversations to go, if there are any words that stand out to you that seem negative, that give you kind of a yucky feeling, your patients are going to feel the same way. So when I do a treatment presentation, I don't say, how do you want to pay for that? Nobody wants to pay for anything. We pay bills, right? We don't like that. I say, how would you like to take care of that today? And in taking care of that implies a few things. They're caring for themselves, but it also leaves them options. It's not necessarily pay. It is pay, right? We do want them to pay, but maybe they need a payment plan. Maybe they have a third-party source they could use. So it leaves them open instead of them feeling cornered that they have to pay. And there's lots of words like that, if you're wanting additional treatment presentation training, we can work through those for your practice and what best fits and help getting that scripting together. But really, it's just as simple as write it down. How do you want it to come across to your patients? Think through those words, write it down, make sure your team knows what you expect. So then you also have something to hold them accountable for. All right, so you want to ask those clarifying questions for increased case acceptance as well. You want to get a deeper understanding of the patient's desired outcomes. And so if you ask a yes or no question, you're going to get a yes or no shut down answer. You want to ask open-ended questions that leave room for them to give you more detail. If you open the floor to them, they're more likely to give you more information. They feel like they're here for you to tell them what to do. You have to give them the space to actually give you more detail on their thoughts, their motivations, and what they're thinking in terms of where they'd like to be with their oral health. Clarity creates the opportunities for you. So you want to look for opportunities to meet those needs that they've expressed to you. We all have the innate desire to be the best we can be, like we discussed in the last Compcare 1, Maslow's hierarchy. If they're at that top level 1, because we're talking about those recalls and pulling them in off your schedule, they're already there. They're wanting to be the best they can be. So you want to discuss with them, what do they see as their ideal outcome for care, and understand their desires to make appropriate treatment recommendations. If they're not aligned, you're not going to get acceptance. All right, so I want you to just peek back through your schedule when you get a chance and find one patient that you missed the opportunity on this week. What went wrong? What can you do differently? And then I also want you to write down the areas from today that maybe you don't have mapped out the way you need to. Do you have a standard of care that's expected? So does your team know what that is if you did document it? Do you have operating procedures for how you want even the phones answered for those touch points with your patients? If you don't, then maybe that's an opportunity this week to work on. But there's always room for improvement. So I want you to really think carefully through what you've done in this past week and the ways you could optimize your practice to improve it for the next time. And then, of course, if you have any questions, you can drop them in the chat, but you can also email them to info@mintconceptions.com. We are happy to answer those. We are doing this to help build back into the community, so definitely send those over if you have any. And, of course, we are going to have upcoming Compcare webinars on creating effective treatment presentations and financial arrangements, and follow-ups and finances, which is a big one. So keep an eye out for those. They'll be coming emails soon. And I just want to thank you again. We are thrilled to have had the opportunity to share our passion with each of you today, because dentistry is definitely my passion. And then, of course, if you are interested in finding out more, you can reach us at info@mintconceptions.com. We work with practices on all areas, so feel free to reach out, and thank you for joining us today.